Good morning, good morning. I'm here enjoying my cup of coffee. Today is day 21 post-op, laminectomy and discectomy. Yesterday they took out the staples. It was not painful, it's just a few of them. I felt a little pinch when it was coming out, but it's just very quick. So it's not painful at all. Nurse says that the incision looks very good. And it was taken by the nurse that comes from the home health. So she came and took it off. She didn't put anything on top. She cleaned it, take them out, and that's it. She told me now to wash regularly with some soap and with my hand with circular motion, and then tap dry with a towel. Swelling on my leg because I have DVT. They found 2 blood clots. If you didn't see my other videos, a week and a half after surgery, they found 2 blood clots on my right leg, which was my problem leg from before surgery, and still is because I still have numbness. So the swelling is getting better. It does. The swelling gets better after I sleep all night. So when I wake up, it's not really swollen. And then as I move around and sit around, it starts swelling again. So I try to do, again, breaks to walk around. And also in the middle of the day, I try to lay down for like half an hour, 40 minutes with the leg up. So it will help. Pain, I did have some little pain on, I will say the low, not my low back, but I will say between my back and my lower back. I don't know if it makes sense. It's just an achy little pain, but that pain happens actually when I sit for too long. So I think it's just, I mentioned it to the nurse. She said it might be because it's still swollen inside the healing area of the surgery, and the fluids also might still around, and it could put pressure when you sit down for too long. That pain goes away when I stand up and walk around. So like I said, I try not to sit for too long, but I did start to work. I work like 2 or 3 hours a day now. I work from home, so I'm on my desk sitting down. But again, because I'm not able to stay sitting for more than half hour, I would say, because my tush gets numb and I feel like I need to stand up. So every 30 minutes, 40 minutes, I stand up and I move around and I sit again. And because of this little pain that I've been having. So it's a combination of sensations and feeling, nothing like before surgery. I feel like it's gonna take a while for everything to heal. Again, my disc was herniated very bad. You won't be able to see the spine cord on the MRIs because it was so compressed. It was no space at all for the spine cord. So, and again, the doctor told me after the surgery, I don't know how you are walking because of how compressed it was. So I guess it probably was some nerve damage. I don't know. My symptoms started in August of last year, so it's not like I've been waiting for too long for surgery, but probably maybe was some damage, or it was just the pressure for those months plus the move around of the nerve during surgery. So the doctor did tell me before surgery that it could take up to a year for all these symptoms to go away. So I'm very patient, and I have to be very patient. Still not using the walker. Still not using pain medicine at all, nothing. Just taking my blood thinners because of my blood clot. That hopefully in a few weeks is gonna go down and away. I have to wait for they explained to me I have to wait for my body to absorb those blood clots. The medicine, what it does is to prevent the blood clot to get bigger, and also it won't be that painful, and it will prevent of forming new blood clots. But it won't disappear, the blood clot. My body has to reabsorb them. And the nurse also mentioned to me that it might be a little painful, that process. So she said, don't be scared if you have a little pain on the back of your calf or leg, here and there, because it's the process of the body absorbing those blood clots. So I'm listening to everybody that gives me advice or tell me what to expect. I use compression socks on the weekend because I went out a couple times to walk and move around. So I did use compressing sock. It's very hard to put it on, so I need help. So during the week, my fiance is not here, so I'm not able to put it myself in the morning. So I'm not using them during the week. I just use them over the weekend. It did help to walk, and the swelling not to be as much on my foot. So it's recommended. So I used it. I did have an appointment with my primary care doctor on Friday, just to follow up about my blood clot. He mentioned to be probably be good to make an appointment when my blood thinners finish, which is going to be around mid-March, with a hematologist, just to check for future reference, future surgeries if I have any kind of blood problem that might cause, or I need to prevent for future surgeries, blood clots, more carefully. What else? Like I said, I start walking outside. I start working more time on my desk. I'm moving around pretty good, doing little things in the kitchen. I made the bed yesterday, but of course not bending, just straighten things up. That's pretty much as much as I could do. So I don't bend, I just squat when I need to squat. And I use the grabber to pick up things that are low. And that's it for now. I didn't think that I needed anything else to get. I will get the scar tape for my scar in the back. My nurse says that I can start using it probably 2 weeks after she removes the staples, but she's mentioned to check with my surgeon. So I will use them to help the wound to heal, not to heal, to scar to disappear. I heard good things. There's a few on Amazon, so I'm gonna use that. So for the people that is concerned about the scar and how it will look, it has good reviews, and I know for some people it did help. So scar tape for the incision. My incision is about, I would say, 5 to 6 inches long. So again, it's on the L4, L5. So I'm not very concerned about it, but I'm just gonna use it to see if it does any difference. Using it right away at the beginning of the scar, and not wait too long when the scar gets older. So that's all for now. If you have any question, let me know on the comments. I will gladly answer any questions. Again, I have laminectomy, discectomy, L4, L5. My symptoms start on around August 2022 with my first flare-up, which put me on bed for a couple days that I couldn't move. And then I have about 4 or 5 flare-ups until I got the surgery. With my last flare-up was the New Year's. Very bad flare-ups. I'm 41 years old. I'm 250 pounds. Besides that, pretty much healthy. I try to eat healthy to try to lose weight. It's not easy, but I'm trying. Because I know that's gonna help a lot. And also, eating healthy helps with healing and all that. I start doing some meditation, healing meditation, with also I think it's good for your soul, for your mind. So I recommend it. There's some videos in YouTube with healing meditation, music, and guided meditation. So if you have half hour during the day and you're alone, just relax. It might make you sleep because I did fall asleep a couple times during meditation, and that's because it's relaxing. So I recommend it. And get help as much as you can from families, from friends, especially at the beginning, because you might need people to be around to help you with things. Like I say before, my fiance stayed with me the first week after surgery, and then he started working again. But I really needed him at the beginning because I was not able to go in and out of the bed by myself. The log roll was hard. Then to go to the bathroom, it was a little hard too at the beginning. And I still get help from him. Like when I go to take a shower, I usually make sure he's here, so just in case. And he opens the shower for me because it's too low, and I'm not able to bend. So things like that. To get dressed, I'm trying to use the grabber. It's a little tricky, but I'm trying. And then I'm now able to put the socks on. The nurse told me that I could raise my leg and cross it on top of my other leg so I can put the socks on. But I'm a little scared still to do that movement. So I'm just use slip-ons for now, because I'm not going to any event or anything that I need to really dress, use dress shoes or anything like that. So I'm using slip-ons and jogs right now and loose t-shirts. So that's what you're gonna need for the first few weeks to be comfortable. And that's pretty much it for now. So again, let me know if you have any questions, and I'll see you later with another update. Thank you.